Dr. Walter Mulombo Kazadi, National Coordinator, Country Coordinator, Africa Center for Disease Control, Dr. Baki Sonko, and Coordinator Saving Lives and Livelihood Project. Country Representative Bill and Melinda Gates Foundation, Yusufari, Your Royal Highness, Al-Haji Engineer Sumaila Muhammadu Mira, OON, Emir of Arugungu, and Chairman, Northern Traditional Leaders Committee on Primary Healthcare. Director, Hospital Services, Dr. Adebimpe Adebi, representing the Permanent Secretary here today. Dr. Patrick Mboya Nkuyu, AFNET. Members of, should I say, the directors from the Federal Ministry of Health, from the National Primary Healthcare Development Agency, and of course, members of my own constituency, members of the vibrant Nigerian media. Very distinguished ladies and gentlemen. As at the 28th of June this year, Nigeria can boast of having vaccinated 30 million people with at least one single dose of COVID-19 vaccine. Healthy herd of Nigerians that will help to revamp the uptake of COVID-19 immunization and also integrate it with other immunization that is important. For us, I can see that almost everybody here is masked. I don't know if related. Having said that, I think it's appropriate at this time, like we always do at a gathering like this, since COVID-19 became part of the health concerns globally, that we appreciate the nurses, the doctors, who have worked relentlessly to ensure that we do survive, because they are the ones, they are the foot soldiers out there. So like we always do, can we please be upstanding and give them a rousing applause? They deserve it wherever they are, in every nook and cranny of Nigeria, all over the world. They have worked so hard. These medical professionals who are now very quickly. Okay, I've just gotten this. We also have representatives from the Christian Health Association of Nigeria, CHAN, Dr. Andrew Mogu. CHAN President, you're welcome. We also have the executive, the Secretary General and Executive Director, Mr. Michael Ida. You're all very welcome. We'll go next to the very, very next item we're going to run, because COVID is still with us. Figures around the world still shows that the virus has not rested, and we are also not going to rest until we see the end of COVID. So we'll move on straight to goodwill messages, and starting us off on the goodwill message, I'd like to call on our host, because we are here in Abuja, the federal capital of Nigeria, and I'd like to call on our host, Dr. Abubakar Tafida, the FCT Secretary of Health, to please kick off the goodwill messages. Dr. Tafida, please.
The Secretary to the Government of the Federation. Apologies, I don't have COVID and I'm fully vaccinated. The Honorable Minister of Health and Honorable Minister of State, the ED, National Primary Healthcare Development Agency, other distinguished guests, we're happy to be here this very moment to launch the Skills 3 program. And it's quite a brilliant strategy whereby we get down to the primary healthcare centers, to our communities, where the level of uptake of the COVID vaccination, as it was earlier stated, we still stand at just around 13 million for the first dose in Nigeria, with a population of 200 million. So all hands must be on deck to see that we scale up that we a level where the I'm sorry, to attain a level where the immunity, that immunity is maintained. So thank you very much, and we hope we have a good deliberation. Thank you.
We can round of applause for the Executive Secretary, Health and Human Services, Federal Capital Territory, Dr. Abakar Tafida. Next, for his goodwill message, and I must also remind all of us that only 3 minutes, I would like to crave on your indulgence, so please stand by the already established protocol so we can move with the speed of light, if it's possible. I'd like to quickly make one quick correction. The Chief Commission is the Executive Director, National Primary Health Care Development Agency, Dr. Faisal Shuaib. Whilst we also put our hands together for the health practitioners and workers, it is also recognize and put our hands together for the FGF leading the Presidential Task Force team and the Honorable Minister of Health and his colleague, his counterpart, Honorable Minister of State, as well as Dr. Faisal Shuaib, the Emir of Arugungu, who chairs the Traditional Leaders Forum on Primary Health Care. Please let's make that applause for them one more time, even louder than that. Thank you so very much. So moving on very quickly with, I'd like to then invite the Chairman Forum of Executive Secretaries, Nigeria, Dr. Adis Mohammed, to please step up to the podium and take his turn with the goodwill messages as well. Dr. Adis Mohammed. Crave an indulgence to please stand by the already established protocol. Thank you.
Very good morning, the Honorable Minister of Health. Already established protocol. I bring you a goodwill message from my colleagues, the Executive Secretaries of 36 states plus FCT. Good morning, all. Welcome you all to this very important gathering of COVID-19 scale 3.0. It is very important for us today to attend this gathering because of COVID-19 vaccination in Nigeria. We are here, some of us are witness to the scale up to COVID-19 vaccination exercise that was launched sometime October last year. So a target was set by the Federal Ministry of Health, the National Primary Care Development Agency, the WHO, and the partners. And we have gone a long way in various states in trying to achieve these targets. But yet, it has become necessary for the National Primary Care Agency and also the states to ensure that we strategize to ensure this herd immunity is achieved in Nigeria. I have no doubt, on behalf of my colleagues, strategy with the plan that has been in place today with the National Primary Care Development Agency with the states, we are going to get there. As a country, all we need to do is to put our heads together, give the Federal Ministry of Health, the National Primary Care Agency, the needed support for us to be able to go there. We should bear in mind that this goal cannot be achieved without us moving together as one family. And there's this saying that if you want to go far, you have to go along with people. Go very fast, you go alone. And I'm sure National Primary Care and the State Primary Care Agency want to go very fast, so we need to move together. So thank you very much on behalf of my colleagues for giving me this opportunity to speak on behalf of my colleagues in various states in Nigeria. Thank you and good morning.
Thank you very much. With your goodwill messages, permit me then at this juncture, Your Excellencies, very distinguished ladies and gentlemen, to invite for goodwill message the country representative, WHO. I'd like to welcome Dr. Walter Malumbo Kazadi.
please allow me to stand on existing protocol. I would like to take this opportunity to congratulate again the government of Nigeria through the SGF and NPA for this yet again another stride. COVID-19 pandemic is showing an uncertainty. No one can tell when it will be over. It will continue and bring new variants. We don't know in which direction those variants will take place. We have a proven tool, the COVID-19. Most of the world that has been affected adversely has gone ahead and vaccinated almost the entire population. Africa has been lagging behind. We need to boost our effort to protect Africa. And if Nigeria can't do it, then nobody can do it. So if I have one advice, let's take this opportunity. Let's get vaccinated. Let's get the booster anytime we have the opportunity. Because only then we'll remain against severe disease, hospitalization, and everyone to get vaccinated. Congratulations again for your attention.
Thank you very much, country representative of WHO, stressing and emphasizing, let's get vaccinated, let's get protected. Figures just reaching us, even as we gather for this Scale 3.0 launch, is that 40 million Nigerians, as at the very, very last count, have also presented for at least the first dose of COVID-19 vaccine. It's important that we do that. Tell your friends, tell your family members, getting vaccinated is protecting not just yourself, but life. We move on quickly with goodwill messages. At this time, I'd like to call on the country representative of UNICEF, a very wonderful partner. Please welcome with me, Mr. Peter Hawkins.
Thank you very much. The Secretary to the Government of the Federation, may I stand on existing protocols. Today is a day of celebration and congratulations. And first of all, may I congratulate the Minister of State on your appointment. This is my first time that I've come to greet him. But in the same way, I want us to celebrate and congratulate everyone involved in the immunization subsector on the extremely good work taking place over the years here in Nigeria. While polio has now does not exist in Nigeria and therefore in Africa, the reduction in infection rates around vaccine-derived polio have reduced significantly. AFP down 84%, and the infection rates more generally down 64%. This is a fantastic achievement upon, and I want to congratulate the Minister of Health, ED, MPHCDA, and the Emir of Gungu for their work on this. Secondly, immunization as a whole has increased from 50% to 57% since 2018, at a time when COVID tried to interrupt that intervention. And again, the Honorable Minister of Health and the ED, MPHCDA should be congratulated for pushing through at the worst time that we were faced with. And then finally, COVID-19. On the 2nd of March, we stood at the Abuja International Airport to receive the first 4.9 vaccines of AstraZeneca. No one today would believe then that today 40 million people will be vaccinated in Nigeria. 25.9% are fully of the eligible population. This is an incredible task, and may I congratulate the Secretary to the Government of the Federation for your stewardship of the Presidential Task Force, the Honourable Minister and the ED MPHCDA for bringing us to this juncture where today we launch Scales 3. Scales 3 is important in that it allows us to look at immunization holistically, allows us to bring COVID-19 into the routine immunization and the integration of immunization as a way forward to protect the health of this nation. In a recent program around Lagos, Ogun and Ocean, 900,000 adults were vaccinated. That is the way forward to integrate the structure. As the Minister of Health repeatedly reminds us, primary health care is the way forward. Immunization is the entry point. COVID-19 with Scales 3 is the way forward to ensure immunization is integrated for all the population, and the success we built on over the past 3 years can be capitalized. Let's get vaccinated. Thank you very much.
Very much indeed. Moving on with the goodwill messages and standing by the existing protocol, I make bold to invite to the podium at this juncture Anne Patterson, the USAID Mission Director and Charge de States Embassy, and of course, standing in here this morning, representing the U.S. Ambassador to Nigeria. Please let's put our hands together to welcome her.
Thank you very much. Honorable Secretary of the Government of the Federation, Honorable Minister of Health, please allow me to also stand on existing protocols. Today is such an important day for public health in Nigeria. Scales 3.0 is the next step in fighting the COVID-19 pandemic, protecting the health of people across the country, and ensuring that no COVID-19 vaccine doses go to waste. Throughout the COVID-19 pandemic, the United States government has worked closely with the Ministry of Health, the NPHCDA, and partners to plan and implement public health efforts, including vaccination to prevent illness and save lives in Nigeria. Together, this partnership has facilitated the administration of over 54 million doses of COVID-19 vaccine. Even though we are rapidly approaching 25%, maybe even higher, I hear today, of eligible Nigerians being fully vaccinated, it is clear there is still work to be done to reach the goal of vaccinating 70% of eligible Nigerians by the end of the year. With Scales 3, the U.S. government is proud to align with the government of Nigeria's plan to strategically utilize mobile with performance incentives in areas with high demand, garner community engagement, and generate vaccine demand, and strengthen data management. The next 3 months, Scales 3 is implemented, will be busy, but I hope very rewarding. I commend everybody for the hard work leading up to today's launch and look forward to seeing Nigeria's vaccination numbers rise.
That round of applause is not loud enough for a partner that is there for all times. We're moving on now to messages. I'd like to invite the National Country Coordinator, Africa Center for Disease Control, Dr. Baki Sonko. Hello.
Thank you. The Chairman, Presidential Steering Committee on COVID-19, the Secretary of State, Government of Federation, allow me to observe the standing protocols, and good afternoon to all. Presidential Steering Committee on COVID-19, Honorable Minister, on behalf of the Acting Director of African Center for Disease Control and Prevention, Dr. Ahmed Awel Omar, I would like to take this opportunity to acknowledge the federal government of Nigeria for its towards safeguarding the health of its citizens. This is demonstrated here today as we all have gathered to witness the renewed efforts of the Federal Ministry of Health and the National Primary Healthcare Development Agency to accelerate vaccination against Nigeria. Mr. Chairman, Honorable Minister, the COVID-19 vaccines remains critical in reducing transmission and ultimately returning our economies to normal. Recognizing that the only way to end the pandemic and livelihoods on the continent is to immunize a critical mass of the African population rapidly. The African Union, heads of states and government endorsed the COVID-19 vaccine development and access strategy on the 2020. This strategy aims to vaccinate at least 70% of the African population with safe and efficacious COVID-19 vaccines, thereby controlling the pandemic and the destructive aftermath on our economies. Mr. Minister, today, as the federal government of Nigeria is launching the Scales 3.0 strategy, the African Union and Africa CDC is honoured to partner the country in ensuring that the goals set out in this strategy are achieved, providing the country through the Saving Lives and Livelihood Initiative. So in June 2021, the Africa CDC, in partnership with the MasterCard Foundation, have come with an initiative called the Saving Lives and Livelihood Initiative to purchase the COVID-19 to 65 million people and support the delivery to millions across the continent. The partnership with the MasterCard Foundation and the Africa CDC will be built on the tremendous and ongoing work of the AVAT, covers WHO, US, EU, and the individual government administrations and supplement the support of various global actors in enabling vaccine equity. Mr. Chairman, Honorable Minister, 4% of the adult population fully vaccinated. This renewed vaccination drive, laid out by the Scales 3.0 strategy, is timely as the country is experiencing an increase in the transmission of COVID-19. In synergy with the federal government of Nigeria, the Saving Lives and Livelihood program will be supporting demand generation activities and the administration of vaccines in 11 states across the country. Additionally, the program will continue to strengthen the country's cold chain system, by procuring the solar-powered freezers. The ultimate goal of the Africa CDC through the Saving Lives and Livelihoods initiative in partnership with the MasterCard Foundation is to accelerate the achievement of the goals set by the African Union to have 70% of the African population vaccinated against COVID-19 by the end of 2022. Mr. Chairman, Honorable Minister, the flag of Scales 3.0 strategy serves as a signal to kickstart the country's relationship with Saving Lives and Livelihood program. This further signifies the existing cooperation, coordination, and support on public health emergency response between the federal government of Nigeria and the Africa CDC. Mr. Chairman, Honorable Minister, on behalf of the Acting Director, let me once again express appreciation to the federal government of Nigeria for the excellent support provided by you and the National Primary Healthcare Agency. Your efforts contributed substantially and the effectiveness of the COVID-19 response, which is enhanced by the professionalism displayed by your staff in providing support and logistics in this crusade. We believe this launching is one of the most productive we have. High-level intervention, substantial progress will be made in this intervention, is in no small part attributed to the support provided by you and your ministry to all the implementing partners. I therefore thank you for your and professionalism with a slogan that we believe as Africa CDC, if the COVID vaccination intervention fails in Nigeria, the whole Africa will fail. So if we succeed in Nigeria, the whole of Africa. Thank you.
Thank you very much. I can confidently say that Africa as a continent, and indeed Nigeria as the big brother, we will succeed. Do I have from everyone out there? That's not very convincing. Most of that we're on live television, so can I have a year from everyone out there? Thank you. Well, I'm sure that is very reassuring. You're welcome. We're moving on, and we're speaking. We have our partners pledging support still, and one of our very big partners that have been with us with other immunization process besides the COVID-19, the Gates Foundation. And I'd like now to invite the country rep of Bill and Melinda Gates Foundation, Mr. Yusuf Sifari, to please address the audience.
I'm the secretary to the government of the federation. My big sister, point of correction, country director, the Nigerian is on Ghana. I'm still Yusuf, a staff of the Bill and Melinda Gates Foundation. I bring to you the goodwill message of the Bill and Melinda Gates Foundation. My country director is unavoidably absent during this very important occasion. The foundation fully supports NPHCDA effort in re-strategizing to really reach every eligible person in Nigeria with the COVID vaccine. The scale strategy provides us with the golden opportunity to not only reach people, but also strengthen routine immunization wherever they live, irrespective of their ability to access service or afford services. The scale strategy are fully supportive of all the efforts, and we are solidly behind the MPA-CDA ourselves in this effort. I'm happy to continue to partner with
very much, and thank you for states and so very many others. Well, thank you very much. Moving on
Thank you very much. So we are very much aligned with the work of our sister agency, the MPHCDA, with all the efforts to deliver vaccines. The executive secretary would like me to do so. I'd like to reiterate that these vaccines, all of the COVID vaccines that are in use in the country, are safe. And as you have heard already, these 27 plus million Nigerians who have received 2 doses and the almost 40 million plus Nigerians who have gotten at least 1 dose. I'm not sure what other evidence we need to be convinced that these vaccines are actually safe for use. As part of the COVID response, we need vaccines along with other public health safety measures like the mask we are wearing to mitigate transmission of virus within the community. If we do not reduce or interrupt transmission, earlier highlighted, we run the risk of generating variants. Actually, with each replication cycle of the virus, variants are generated. The issue is the lottery that would result in a variant that will all of us and lead to what we experienced in the first few waves of the pandemic. So please take on board safety measures, including the use of vaccines. But more important, I think I would like to close by commending the MPHCDA for the Scales 3.0 launch. We are discussing this in the context of the COVID pandemic, but what is also important, this is perhaps one of first of many steps that need to be taken towards actually having a life course approach to vaccination in the country, where all populations, regardless of ages, children, adults, can all go to an integrated service point and receive all of the vaccines that they are meant to receive. Again, congratulations to the MPHCDA team and of course to the SGF and the Ministry, Honorable, for their leadership in this and other aspects of the COVID.
quickly would like to examine not just commission invite your Royal Highness Alhaji Engineer that.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والصلاة والسلام على Boss Mustafa, the Honorable Minister of Health. Assalamu alaikum wa rahmatullah. I stand before you wearing 2 caps or 2 turbans. I'm President General of Nigeria's Foreign Council for Islamic Affairs, and that I, with my capacity, as Emir of Bungu and Chairman of the Traditional Leaders Committee, I convey warm greetings and commendations of eminence to the ED, the PhD, and all organizers and partners that facilitated the convention. He has asked me to convey to you his commitment to provide purposeful leadership by example from himself and his family as a testament to the safety and efficacy of vaccines. The federal government and its agencies was also pledged to continue to mobilize all traditional religious leaders to accept and promote these values in the areas of influence. We wish to all successful deliberations and success in the endeavor to protect all Nigerians from COVID-19. In my capacity as chairman of NTA, I give thanks and praise to Almighty Allah to be here today with the launch of the SCARES 3.0 strategy for integrated COVID-19 vaccination in Nigeria. On behalf of the Nigerian Leaders Committee of Annual Healthcare, I want to thank President Muhammad Buhari for his guided commitment to protect Nigerians against the deadly COVID-19 pandemic. I could recall early in 2019 and 2020, we could not go out of our houses with the fear of contracting the disease. I need no time to social well-being. Today, the story has changed 19. This did not happen, but I congratulate the Executive Director of the National Family Healthcare Agency and all implementing partners with the progress made to restore Nigerians that are yet to receive their COVID-19 vaccination to take advantage of the launch of SCARES 3.0 to do so, and in the process, access routine immunization and other healthcare services from the same outlets with their family. And have taken two more since then. Millions of Nigerians have also received the vaccines, and we are all yet to see evidence of any. It has been over 12 years since the NTA was inaugurated and admitted as a working partner at grassroots level with MPHDA. And the launching of SCARES 3.0 as a continuation of what we started since then. We thank the Primary Healthcare Agency and all our partners and benefactors, especially these families you, for the benefit of our community. Thank you. Wassalamu alaikum.
Ladies and gentlemen, Madam Examiner for the royal family.
And furthermore, to answer frequently asked questions, we want to do scientific points for you. I am vaccinated. I've also had my booster. Have you
I'm also fully vaccinated and fully boosted.
All this attests to the fact that all vaccines in the country are safe for use. The vaccine is confirmed for use. It must receive approval and authorization from the World Health Organization in Nigeria. In addition to WHO approval and authorization, the National Agency for Food and Drug Administration and certifies all vaccines, including COVID-19 vaccines, safe for use. Even when the vaccine is in use, NAFDAC continues to monitor the vaccine to ensure all safety guidelines are maintained.
There's also a question here, can the COVID-19 vaccine make me magnetic? The answer is capital no. COVID-19 vaccines cannot make you magnetic. COVID-19 vaccines do not contain metals or any electromagnetic. The vaccines are safe and very, very effective.
Does COVID-19 vaccine cause impotence? No. COVID-19 vaccine does not make a man impotent. There is no empirical trials indicating that COVID-19 vaccines will cause impotence. The vaccine does not and has not caused impotence anywhere in the world. COVID-19 vaccines are safe, effective, and free.
And for the benefit of those of us at home and watching via the Nigerian Television Authority, the largest television network in Africa, does COVID-19 cause infertility? And the answer is no. COVID-19 vaccine does not cause infertility in either women or men. There is absolutely no data from clinical trials indicating that COVID-19 vaccines could cause infertility. Vaccines do not cause infertility. COVID-19 vaccine is safe, effective, and free of charge.
Who can then receive COVID-19 vaccine? In Nigeria, the COVID-19 vaccine is to persons 18 years and above and older, including pregnant women and lactating mothers. This is a scientific proof. Please go out today if you've not been vaccinated. Ensure that you can and also spread the good news that COVID-19 vaccine is safe and is free.
And please spread the message. Thank you very much. As we move on very quickly, Your Excellency, very distinguished lady, we'd like to then invite a cultural trip to just light up the mood here a bit, and we'd like to invite good news cultural trip. Let's have you for 3 minutes, please. Can we give them a round of applause, please? I'm going to a round of applause for them. And I hope you have been vaccinated. If you've not been vaccinated, as you leave this place, you're vaccinated and also spread the message and not the virus. Thank you very much. We'd like to recognize very quickly the presence of MasterCard Foundation team and the entire African CDC team that are here. Can we please put our hands together? I would also must at this point in time acknowledge the strategic group, which is made up of science and partners supporting the fight against COVID-19. Can we give all of them a resounding applause? Thank you very, very much. It is at this point that we want to get full after that side attraction by God's Time is the Best cultural troupe. But up to this point in time, bring up to the podium the man I call the man in the eyes of the storm, the Executive Director and Chief Executive Officer, National Primary Healthcare Development, for the introduction of 3.0 strategy for accelerated and completed COVID-19 vaccination in Nigeria. Dr. Faisal Shiayi. Please let's give it up for him in admire, please.
Thank you. The Secretary to the Government of the Federation and Chairman of the Presidential Steering Committee on COVID-19, the Honorable Ministers here present, the Emir of Albungu, distinguished ladies and gentlemen, permit me to align behind the established protocol. Good afternoon and welcome to the official launch of the Scales 3.0 National Strategy for COVID-19 Vaccination in Nigeria. You will recall that 6 months ago, in February, part of our optimized Scales 2.0 strategy to ramp up integrated COVID-19 vaccination and primary healthcare services. With this strategy, our national vaccination coverage progressed from 17 million to 40 million as of today for the first dose. These figures represent over 100% increase in coverage during the first phase. This is attributable directly to the leadership provided by the chairman of the Presidential Steering Committee on COVID-19, the Honorable Ministers of Health, state governors, traditional and religious leaders, but especially the dedication and tenacity of frontline health workers. Can we please give them a round of applause? As you must have heard earlier, as of today, the 8th of August 2022, the number of eligible persons who are vaccinated currently stands at 27,703,573. Therefore, the proportion of the total eligible population that have been vaccinated in Nigeria is 25%. Progress we recorded with optimized Scales 2.0 implementation is appreciable. Our strategic review also showed that there has also been an increased low COVID-19 risk perception, which needs to be. Our disaggregated state performance analysis also revealed that there are important state-specific bottlenecks that must be addressed in their various contexts for us to see improved vaccine uptake. Ladies and gentlemen, it is for these reasons, among others, that the Presidential Steering Committee on COVID-19 and the Federal Ministry of Health, through the National Primary Healthcare Development Agency, have come up with the Scales 3.0 strategy to officially flag off. Scales 3.0 is an evidence-based update that fixes the bugs in Scales 2.0 and uses human-centered demand generation design to address low risk perception in the country. The strategy retains integration of COVID-19 vaccination with other PSC services, but uses an implementation approach that seeks to address bottlenecks on service delivery, communication, ability, logistics, the EMIT platform, and supportive supervision using a bottom-up and state-specific contexts. So what does the abbreviation Scales 3.0 stand for? It stands for service delivery. Scales 3.0 will operate on focused campaign mode with mobile and special teams taking vaccines to where people live and work. This will address the operational issues with the temporary fixed posts and mass vaccination sites that we observed in Scales 2.0. C is for communication. Scales 3.0 will employ decentralized demand generation approaches, targeting grassroots opinion leaders, influencers, traditional and religious leaders. This is expected to strengthen the results from our targeted advocacy, media, and community engagement. A is for accountability. Scales 3.0 supports timely logistics and payment of vaccination teams that have achieved thresholds and targets. What discipline means is that Scales 3.0 will not only be tracking vaccination activities, promptly addressing inappropriate and fraudulent activities using our joint task force, but will also implement a carefully designed performance-based incentivizing mechanism to encourage accountability of your performance. L is for logistics. Scales 3.0 optimizes integrated vaccine supply chain and last mile stock visibility to minimize stock outs of vaccine expense. On this, we want to appreciate our donors and development partners for the support they continue to provide at the subnational level. E is for electronic management of immunization data, what we call EMI. 3.0 will ensure visibility of vaccination teams on EMIT platforms, as well as data access and use for action at subnational levels. S is for supportive supervision. Scales 3.0 strict deployment of well-trained supervisors, on-the-job mentoring of vaccinators, and the use of GPS to ensure that supervisors also cover not only urban areas, but rural and hard-to-reach communities. From the foregoing, ladies and gentlemen, I hope it is clear that in this phase of COVID-19 integrated campaign, all hands must be on deck to execute the highest quality of operational delivery with attention to every potential pitfall and overcome them promptly. We will be kicking off the Scale 3.0 campaign today by having the chairman of the Presidential Steering Committee, Barrister Boss Mustafa, second booster dose of the COVID-19. This will be followed by members of the high table, and participants of this flag off will be given the opportunity to be among the first Nigerians to dose of the booster doses. Finally, I want to remind Nigerians that COVID-19 is still very much present in our country, and it remains a formidable threat to our collective health and well-being. We take necessary measures to protect ourselves against COVID-19. Take advantage of our integrated services to access care in our health facilities and other designated locations. Please get vaccinated and keep your community and the country safe from COVID-19. I thank you. God bless you. God bless the Federal Republic of Nigeria.
That is a charge from the and so, ladies and gentlemen, the charge is please get vaccinated, and each time you're vaccinated, you won't be able to spread the virus. And so, ladies and gentlemen, another big round of applause for the executive primary healthcare development agency. Thank you, and thank you for the tremendous work that you are doing with the great support of the SGF, the great support of the Honorable Minister and Minister of State, as well as the Federal Republic of Nigeria, President Muhammadu Buhari, GCFR. Please a round of applause for him in absentia. Moving on very quickly, we'd like to invite for his remarks the Honorable Minister for Health. We'd like to invite Honorable Elkuman Nkama, Joseph Nkama. Please let's welcome him to the podium for his remarks with a very resounding applause, please. Honorable Minister of State.
The Secretary to the Government of the Federation and Chairman, Presidential Steering Committee on COVID-19, the Honorable Minister of Health, Emmanuel Ihinere, all protocols duly observed. Distinguished ladies and gentlemen, I am honored to be and pleased to address you on this very important occasion of CARE Zero launch. This is my first official statement on COVID-19 vaccination campaign in Nigeria as the Honorable Minister of State for Health. I am sure we all have been following the efforts of the Federal Ministry of Health, championed by the National Primary Health Development Agency, to ensure that all eligible Nigerians are protected against the pandemic. I would like to begin with the executive of our dear country, President Muhammad Buhari, for giving me the opportunity to directly partake in this effort, among others. It is by no means an easy task for Nigeria and the world to have brought COVID-19 pandemic control, looking at the trajectory of our country's response. I would like to profoundly appreciate the efforts of Presidential Steering Committee on COVID-19, led by Barrister Bose Mustafa, much to the coordinating performance of the Federal Minister of Health under the leadership of Dr. Osege Ehianire. As our soldiers in the war room and on the battlefield, and by this I'm referring to National Primary Health Development Agency, I commend the ingenuity and swiftness of Dr. Fasel Schwab and his team, who have continued to innovate and deploy strategies to fight COVID-19 in Nigeria. Challenges of strong and widespread misinformation and disinformation, National Primary Health Community Development Agency have innovatively been able to convince nearly 40 million eligible Nigerians eligible persons in Nigeria, including my humble self and my family, to willingly take COVID-19 vaccine. Distinguished ladies and gentlemen, I am fully vaccinated and fully ready to join the war room against COVID-19 pandemic. As we are already aware, the SCARES 3.0 offers a unique opportunity for accessing integrated vaccination services against COVID-19 and child health diseases such as measles, polio, whooping cough, yellow fever, as well as other PHC services in government-approved sites. What this simply means is that adults who are eligible for COVID-19 can have them in the same place and time where children can receive vaccination against child killer diseases listed above. May I quickly emphasize that vaccines have remained the most effective way to control diseases in the world. Contagious diseases such as smallpox and polio were eradicated through vaccines. Many other diseases of public health concern have been brought under control through vaccination. The misinformation that followed the outbreak of COVID-19 is not strange. It was part of the difficult history of polio vaccination. Today, we have successfully eradicated polio in Nigeria, how we were misinformed about the vaccine. It is the same way we shall forget how we have been misinformed that COVID-19 vaccine are meant to kill and cause magnetic effects. First 3.0 as a moment of opportunity that every adult and parents must not let go to get themselves and their families protected against diseases that can kill us and our children or rendering us moribund. I'm aware that a range of related activities on service delivery, communication, accountability, and logistics, electronic management of immunization data, and supportive supervision will be going into implementation of SCARES 3.0 have been effectively designed to be state-specific and driven by evidence. For this reason, among others, I am confident that Nigeria will be moving more rapidly towards attainment of herd immunity against COVID-19, which as much as I envisage improvement in our overall health indices. May I end by imploring all participants and all eligible persons to take advantage of the opportunities of 0.3 strategy to access health service wherever you are, maybe in this country. Let us particularly remember that COVID-19 is still around us and requires everyone to continue to take necessary sanitary precautions to protect ourselves against this disease. Thank you for listening, and may God bless us and the Federal Republic of Nigeria.
Well, thank you very much, the Honorable State for Health. The Federal Ministry of Health has been in the forefront, as well as ensuring that the National Primary Healthcare Development Agency goes to the nook and cranny of Nigeria to ensure everyone the COVID-19 vaccine. As we push forward to contain the virus, may I at this point, Your Excellencies, all very distinguished ladies and gentlemen, to invite the Honorable Minister, Dr. Osagi Ehagire, to please address the gathering. Honorable Ministers.
The Secretary to the Government of the Federation and Chair of the Presidential Steering Committee, Honorable Minister of State for Health, I would like to rest on existing protocols so well established in order to save time. On behalf of Health, I welcome you all to the flag off of the Skills 3.0 strategy, whose purpose is to accelerate the integration of the COVID-19 vaccinations with our routine immunization program for more benefit on both sides. This very important project is a major step in our common resolve to the COVID-19 virus, and at the same time scale up routine immunization so that one is not being done at the expense of the other, but rather build a in immunization ecosystem that addresses all stakeholders' concerns. The federal government has, through the National Primary Healthcare Development Agency, earlier developed various strategies, including the optimized Scales 2.0 strategy to ramp up COVID-19 vaccination by integrating it with primary health across Nigeria, which has improved the vaccination tally significantly. However, total performance still falls short of our desire, because as of the 3rd of August 2022, only about 25% of eligible population has been fully vaccinated, with only 3 states, Jigawa and Kano, having a vaccination coverage of over 50%. I would like to particularly thank the governors of these states for this effort, which shows that it's to achieve these targets. We are left with 34 states, and when I mention 34, I also include the FCT, performing not quite optimally in vaccination. Hence the need for the team to refine the current 2.0 skills strategy to accelerate the vaccination by identifying the enablers that are unique to each state and developing them and also deploying them as state-specific strategies that will help us to ramp up coverage. This is 3.0 strategy, and it will be anchored on an intensive 3-month campaign with performance-based incentives, optimized integrated package of services, and incentivized demand generation strategies, partner coordination and accountability, and the state-specific context and strategies. Based on these principles, is hopefully going to curb the spread of the COVID-19 virus and gain the desired herd immunity as quickly as possible. While we are ranked amongst the high-performing countries in the COVID-19 rollout in Africa, we can't but acknowledge the fact that we still have a lot of work to do. We are far behind. We need to run. And we need the statistics advise us, which we are quoted above. We need to roll up our sleeves and get moving. We recognize the fact that the campaign can, if there is mass mobilization of the people. We are therefore calling on state governors again, local government chairmen, community leaders, traditional leaders, religious leaders, the media, and all Nigerians in their individual capacities, including NGOs, to lend their support to mobilizing the unvaccinated eligible individuals to register and get vaccinated, or to walk to the nearest vaccination center to be vaccinated. So the Skills 3.0 is therefore a scale-up of the Skills 2.0, and we shall continue reviews, assessments, and critiques of our vaccine delivery strategy and use lessons learned to seek ways of further improving acceptability and performance in this respect of both the NPHCDA and the Federal Ministry of Health. The federal government remains committed to the provision of safe, efficacious COVID-19 vaccines in Nigeria, backed with accountability and transparency. Every COVID-19 vaccine in Nigeria is tagged and tracked by NAFDAC, National Agency for Food and Drug Administration and Control, to ensure potency are maintained across the entire supply chain. We are guided by the principle of safety, efficacy, and transparency in mass vaccination campaigns. No vaccine will be allowed to enter any vaccination site without due authentication and verification. We will not compromise on vaccine safety and standards. I wish to, on behalf of the federal government, express appreciation to those countries who have contributed much to sharing their lessons with us and providing us with, and therefore giving us a lot of, and also providing us with technical support and other forms of backing. Just last week, the United States government allocated another 1 million doses of Pfizer vaccine to our inventory that we are grateful. We have also enjoyed similar offers and donations from various friendly countries in Europe and Asia, especially those going through the COVAX. We must not fail also to recommend the contributions of the World Health Organization, UNICEF, West African Health Organization, Global Fund, Africa CDC, who have helped and supported us in standing up to the challenge of COVID-19. I wish at this junction to emphasize that taking COVID-19 is just an act of self-protection, but also a civic responsibility that helps to curtail the spread of this virus in our country. Every one of us has a critical role to play in the effort to stop the vaccine from spreading. I want again to urge all citizens to ensure that eligible persons around you, your friends, relatives, are vaccinated. With all of this support, at the moment it's not availability of vaccines, but we want to develop the strategies to improve delivery of these vaccines. I shall also remind us that we must continue to prevention and control protocols such as regular hand washing, wearing of a mask, maintenance of physical distance, and that is very important, physical distancing, and avoiding large gatherings, simply because large gatherings capacity for physical distancing. Especially we hear of new threats of other variants of the Omicron that are emerging. Some of them are of concern. And I'm sure that coming together, we shall surely prevail. I want to end up again by mentioning the question of masks. Masks have not been removed. The PSC it strongly advises that you wear a mask, especially if you're in a very close environment. If you're in an elevator, if you're in an airplane, if you're in a large hall that is also loaded with people, of which you know that a good percentage are not vaccinated, or maybe carrying the virus without having symptoms, you're at risk. So the strong advisory is to keep your mask on under those circumstances. In the open air, you are at less risk because you have a good ventilation. And also if you're in a closed environment like a bus, you're at increased risk. You try to improve ventilation. I always wind down my window a little bit to allow air exchange, even within the vehicle, to reduce the risk of transmission. For your attention.
Thank you very much, Honorable Minister, and thank you for those reminders of the protocols that are in your hands regularly. A lot of times we forget now. Use also the hand sanitizer if I'm able to include that. If there's no water to do justice to your hands. I do know that we are winning the battle, and I'm happy that at least I can say about 98% of us in this hall are wearing our face mask. So give yourselves a round of applause. The Presidential Steering Committee on COVID-19 has been and moving forward to integrate COVID-19 with immunization in Nigeria. Your Excellencies or Honorable Ministers. Oh, okay. Well, the man who will take messages that have been read out since we started this special occasion is the Director General of the Nigerian Orientation Agency. They have offices everywhere of Nigeria and speaking all the Nigerian languages. Dr. Gadba Abari, who is the DG, is here with us. Please, let's welcome him warmly. Thank you very much, my brother. The work is still on, and I'm sure that we'll get there. So, let me bring on to the microphone our great brother and boss, as his name sounds, who will do this and also launch the Skill 3.0 strategy and also lead by example. Please welcome with me Barrister Boss Mustafa, Secretary to Government of the Federation.
Thank you, Moji. Honorable Minister of Health, the Honorable Minister of State Health, the Permanent Secretary ably represent, Your Excellencies, members of the Diplomatic Corps, our development partners and donors, led by WHO, UNICEF, US government, African Aid, CDC, Bill and Melinda Gates Foundation, and other heads of different organizations, friendly countries that have been very supportive in our coordination of the national response against COVID-19. Your Royal Highness, the Emir of Argungu, Engineer Alaji Samaila Muhammad Mera, ON, who is standing here in double capacity as the chair of the National Council for Traditional Rulers, particularly of primary healthcare development in our country. The Executive Secretary of the National Primary Healthcare Development Agency, with heads of here present, and the secretaries or executive directors of state agencies that are joining this meeting either physically or distinguished ladies and gentlemen, gentlemen of the press. It gives me great pleasure to address you at this Skills 3.0 strategy and initiative by the National Primary Healthcare Development Agency aimed at accelerating integrated COVID-19 vaccination and the primary healthcare services across the country. Not only does it give me pleasure, but I think it would help me crafting a response to my principal, who I always see every week to give an update of what is happening with COVID-19. And one of the pertinent questions he always asks is, how do we scale up the uptake of vaccines in the country? It has been quite a burden on him because every week change, but not in a manner that correspond with the target that we've set for ourselves to vaccinate at least 70% eligible population. So this launch today would give me additional impetus and facts and figures that will help me in addressing the issue when I see him tomorrow. So this is quite delightful for me, but also worried that we are on the right trajectory of scaling up vaccination, not only for COVID-19, but integrating it with other vaccines for which we want our people to take. Nigeria has continued to experience changes in the factors that influence demand and uptake of COVID-19 vaccines. This changing situation is uniform across the country. They vary from state to state and therefore require continuous review of our strategies for promoting demand and ensuring vaccines access and accountability. Earlier in February 2022, we launched Optimized Skills 2.0 strategy, which, even though has proven to be effective of COVID-19 vaccination coverage, the proportion of fully vaccinated Nigerians is still low when compared to the set target. The present record of only over 10% of the total eligible population of fully vaccinated as at 3rd August 2022 leaves much to be desired. By our set target, even at the committee, we ought to have gone beyond this now. So this is a reminder that we need to scale up. And I believe the launch of skills would be an impetus for scaling up and doing that as quickly as possible. Over 576 million that are being infected globally. Fatalities, they said, 12.5 million or more by now, with over 256,000 plus fatalities. Locally in Nigeria, we're still oscillating around 265 or so thousand infections, with 3,147 fatalities. Every life lost as a result of COVID-19 is regrettable. So we have a lot to do. And the issue is that we are not dealing with vaccine shortage. So far, sharing with the executive director before I got to the podium, we have well over 38 million different brands of vaccines in our cold chain facilities. So there's no question of vaccine shortage, it's vaccine hesitancy that we are dealing with. And I believe the processes that will be put in place will greatly assist in deepening the uptake of vaccines all over the country. By now, every aspect of the administration of vaccine and vaccination to the rural area and using probably the primary healthcare facilities in those areas. We need to take the vaccines to the people now. We do not expect the people to turn up in the local government or in our health facilities. So the integration of COVID-19 vaccines, along with at this moment, would tremendously assist us in raising the number of people so that we can get quickly to a substantial number of Nigerians vaccinated and double vaccinated with even booster vaccines. The Scales 301 strategy will address the identified implementation gaps in Scale 2 data report. Distinguished guests, ladies and gentlemen, as the virus is still very much around us and can mutate, we must encourage all around us to get vaccinated. Let us also not relent on observing the or non-pharmaceutical measures like wearing our mask, keeping physical distance, and washing our hands regularly. At least 70% of eligible Nigerians to achieve herd immunity. No one is safe until everyone is safe. Like HIV, no day show for face. I returned from Lagos this morning. I was at an event yesterday. Except for my wife and I, stewards that were serving, nobody was wearing a face mask. At a certain moment, I was the special guest of one of the occasion, and I looked very strange. Occasionally, when people come around wanting to talk to me, they are not even very sure about who I was. So occasionally I'll put off my mask just for them to be able to identify me facially. From what I get from NCDC and the other agencies that are charged with that responsibility, it's a clear indication that we are not out of the woods yet. And like the Honorable Minister of Health rightly observed, we are transitioning to dealing with different variants that are definitely going to show up. Because as long as there are carriers who do not even know that they are carriers, and they're busy spreading the virus, who definitely woods unless we ramp up our vaccination and we get everybody that needs to be vaccinated, properly vaccinated. So let's continue with the non-pharmaceutical interventions that have been put in. It's odd, it is a little bit difficult. We are weary, people are tired. I understand where people are coming from. They want their living conditions, and now you are imposing the wearing of masks. It's quite uncomfortable. We've done it in the last 3 years, and it doesn't look as if we can get. But I urge Nigerians that nobody has discarded the use of masks. As a matter of fact, right now, we should place it in an enclosed environment. When we're traveling in vehicles, we appear in rather congested areas. And as much as possible, as we get close to the end of the year with all the number of festivities, we must try to avoid as much as possible crowded environments, especially where you have tons of people that, as far as they are concerned, COVID is consigned to history. And it's not a thing that should bother them now. They have more important things to deal with. May I, at this juncture, commend the National Primary Healthcare Development Agency, ably led by Dr. Faisal Shaib, our partners, friendly governments, especially our governors, for their sterling leadership and oversight. The invaluable commitment and support of the Federal Ministry of Health in coming up with this, I believe, is phenomenal, because that would help us push out the millions and millions of vaccines of different brands that we have in our cold chain facility. I therefore wish to urge all stakeholders to mobilize their communities. This is where His Royal Highness, the Emir of Argum, in their communities, is spreading and advocating for and the safety of the COVID-19 vaccines. I therefore wish to urge all stakeholders to mobilize their communities, age 18 years and above, that they all get vaccinated. I also urge parents to ensure that all eligible children receive the vaccination, as well as those other vaccinations against childhood diseases. At this point, I want to thank you for your kind attention, and I ask that God continue to bless you and bless the Federal Republic of Nigeria. Well, I've been reminded that I'm going to be the first guinea pig again. On this note, I have the singular honor and privilege to officially flag off the launch of the Scales 3.0 of the people of Nigeria, and in giving glory to God.
We'll be inviting the Honorable Minister of Health and ED, National Primary Healthcare Development Agency, to lead the SGF to the vaccination point where he will be vaccinated. Just as he told you, he was the first. The chairman of the presidential story in to his message. The minister is leading and accompanying him. The minister is not going to be there alone. We have a few others. The mayor of Argungu will also join him.
Let us know that the secretary to the government of the federation is taking his booster. He has at some point taken his first, second immunization, second dose, taking his first booster, Now he's taking his second booster. And that's why upscaling for those who have taken their first doses and second doses and of course boosters to ensure that they themselves present themselves to be vaccinated.
I'd also like to plead with the members of the press that you're covering, blocking the views of our distinguished guests, especially those who are meant to be vaccinated here this morning. This is for those who have not been vaccinated fully. If you've taken your booster shot, this is the second booster shot, and that is what the SGF is being administered right now, or rather it's being administered to the SGF right now. After him, the Honourable Minister of Health will take his turn. Thank you very much. A round of applause for the Special Guest of Honour of the SGF as he returns to his seat.
Thank you so much, sir.
Thank you very much, sir.
Thank you for being presenting yourself, guinea pig, so to speak. Thank you so much, sir. That's him.
And then the Honourable Minister is taking his turn.
Yes, and then we'll have the Honourable Minister of State. We'll have His Royal Mayor of Argungu. And of course, the
Executive Director
and
National Primary Healthcare Development
Executive
Agency.
Officer of the National Primary Healthcare Development Agency, who would also present himself for his second booster. Whilst this is going on, thank you, Honorable Minister. We'd like to, I know that some of my colleagues would like to, it is here present. Shortly after this, the SGF will be ready just before he goes so that you can capture him for his reaction. Thank you, Honorable Minister. Before you do second booster, painful?
You want me to answer?
Yes, sir.
In second booster, that makes 4 shots in total. And for good reason, we have been able to, let us say, escape the COVID virus so far.
Thank you. Yes, Minister of State has also taken his own booster. I'll just say to the microphone, Honorable Minister, your booster, your second booster,
Yes,
and everything fine?
very well.
Okay,
Thank you.
thank you. At this moment, yes, the Emir of Argungu is there, and he has always championed immunization. We cannot write the history of polio eradication initiative in Nigeria without mentioning Her Highness, the Emir of Argungu. Thank you. With action, next is the Executive Director of the Primary Healthcare Development Agency. He should also present himself a say. I can see that my brother, the DG National Orientation Agency, has also presented his arms to be jabbed for his booster dose. Thank you. You're not. Yes. Our partners too, members of the diplomat and of course WHO, UNICEF country reps are also presenting themselves. CDC country rep here is also presenting herself. The ED there on your National Primary Healthcare Development Agency, ensuring that he's also jabbed. And I can say to you that I would also present myself for my second booster dose. Spread the news. Ensure that everyone around you who is eligible, 18 years and above, should present for immunization or vaccination against polio. Sorry, against COVID-19. Haven't worked all my life ensuring that we eradicate, where you can know that the brain speaks to it, but then it is also an evidence that immunization is safe. Immunization is the best way to go. Public health physicians will be cost effective and extremely important to our children, and we can see that even as grown-ups, we need it to contain COVID-19 virus.
Thank you very much. Elder sister and mentor in this business. Very quickly, ladies and gentlemen, please, as we leave here today, do please impress it on Nigerians, especially those that are eligible for vaccination, that it is very effective, it is not harmful, it is free of charge, and that everyone must be vaccinated society to be free of the virus. And the more vaccinated we get, the more healthier the nation and all of us become. And so moving on very quickly with a very kind permission of, I see Peter Hawkins taking his second booster. And if you haven't done yours, perhaps at the end of this event, when we eventually bring this to a formal close, we'll be able to invite quite a good number of you to take it. And so moving on very quickly, because we're taking into cognizance the event. So at this point in time, without much ado, invite for the vote of thanks the Permanent Secretary, Federal Ministry of Health, Mahmouda Maman, able represented here at this occasion, Director Hospital Services, Dr. Adebimpe Adebiyi, who is quickly going to give the vote of thanks, and then we'll take the photographs.
Giving glory to the Almighty God that Nigeria can have people like this today. I have the honor and the privilege of representing the Permanent Secretary, Malam Mahmouda Maman, who is unavoidably absent. The Secretary to the Government of the Federation, Hanire, the Honorable Minister of State, Honorable Joseph Ekumankama Nkama, the annals of our dear nation, Nigeria. Today, we have seen the Secretary to the Government of the Federation flagging off the Skills 3 strategy by himself. And this also reminds me that we have put in that a man who is unassuming. He led the Presidential Task Force, now the Presidential Committee on COVID. I know the day when there was the lockdown, when everybody was afraid to even go outside the streets of Nigeria. He was there in the air, yes, going from vaccination. He is that man that action on his words. Thank you very much, sir. My Honorable Minister of Health himself, of course, every week I must submit a report on the updates on case management of COVID-19 to him, which we must discuss at the Situation Room in the Federal Ministry of Health. He does not take an answer. Thank you, sir, for your leadership. The Honorable Minister of State, of course, He's new in the ministry, but gladly and smoothly puts his feet in the shoes of his predecessor. Sir, we appreciate your encouragement. It has actually encouraged us that it is not about the person, but about the office. Thank you very much, sir. We have our royal fathers solidly behind us, being represented here this afternoon by the Emir of Argungu. Thank you very much, Your Royal Highness. We also have representatives of our religious. Without them, of course, we are religious people in Nigeria. We would have turned some of these things into some preachings that will discourage people. We thank you for being part of this. Distinguished ladies and gentlemen, I will want to request all of us to give ourselves a round of applause, because if we will remain in this room, deserve a round of applause. Thank you very much. God bless you.
Thank you very much. Can we please make an applause for Dr. Adebipe, representing the Honorable Permanent Secretary. We'd like to just invite those of you on the head table for a group photograph, and then we invite a few of you from the other side, led by the SGF, the ED, National Primary Healthcare Development Agency, is also going to be joining them. I learned his grant and interview at this point, but please, members of the head table, please join them. We can do as much as take down our map, just momentarily, for the purposes of just the pictures. Just for the pictures, please. And we thank you. Release the ED very quickly, because this is an opportunity for these photographs. Everyone, it will be in the archives. It will also go on the newspapers, that much I tell you, and of course in the news as well. So ED, can someone beckon on the ED and the Emir of Argungu, Emir of... Okay, let's take this whilst we wait for the ED. Okay, ED is here already. Please let's welcome Dr. Faisal Shoaib to join them. We have the DGNOO, Dr. Garba Abari, FCT Secretary of Health, and then, of course, the Chairman Forum of Executive Secretaries, Dr. Abdis Mohammed, Dr. Anas Kolo. Yes, I'm not sure I'm leaving anyone out. African CDC is here. DGN CDC. Already here? Okay. So let's have this very quickly before we bring it to a close. Please let's have the national anthem on cue. The national anthem will come up just immediately after the photograph. We have taken down our masks and now we can wear them so that this one will be what the president will see. Okay, please, if you have the national anthem, after that vote of thanks, can we please all rise for the national anthem? Please. The national anthem, please, if you have it ready. Thank you very much. On behalf of the Chief Convener of this occasion, the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shoaib, and all the directors, and of course, the Ministry of Finance, the Minister and Minister of State, all the directors from the Federal Ministry of Health, and my senior colleague and my auntie, Dr. Chief, this is Mojima Konjola, and the Gabriel, wishing you a very pleasant day ahead. God bless you, son. Thank you very much and have a great day.
From dusk to dawn, 24 hours a day.